Hello and welcome. We will continue where we had left in part 1. Let's start. The learning objectives are shown. Please take a look. Loop diuretics are the most potent class of diuretics and act in the thick ascending limb of the loop of Henle. This segment normally reabsorbs about 25% of filtered sodium. Loop diuretics inhibit the sodium-potassium 2 chloride symporter located in the luminal membrane. This disrupts the countercurrent multiplication system and reduces medullary hypertonicity, thereby impairing water reabsorption. Their powerful natriuretic effect makes them useful in treating severe edema due to heart failure, liver cirrhosis and nephrotic syndrome. They also increase calcium and magnesium excretion, making them useful in hypercalcemia. Loop diuretics remain effective even in reduced renal function, which makes them suitable in acute renal failure and pulmonary edema. They rapidly reduce preload by venodilation, which helps relieve pulmonary congestion before diuresis begins. Their rapid onset makes them useful in emergencies. Adverse effects include hypokalemic metabolic alkalosis, dehydration, hypotension and ototoxicity. Monitoring of electrolytes is necessary to prevent arrhythmias due to hypokalemia. Hearing impairment is more likely when used with other ototoxic drugs like aminoglycosides. Loop diuretics may cause hyperuricemia and precipitate gout. Because many diuretics are sulfonamide derivatives, a sulfonamide-like allergy may occur except with ethacrynic acid. They also increase lithium levels by reducing its clearance. NSAIDs may reduce their action by decreasing renal blood flow. Thiazides are the most widely used diuretics for long-term treatment of hypertension. They are absorbed orally and have a longer duration of action compared to loop diuretics, making them ideal for chronic therapy. They act in the early distal convoluted tubule and inhibit the sodium chloride symporter. This produces a moderate but sustained diuretic effect. Thiazides reduce peripheral vascular resistance over time, which contributes to their antihypertensive effect beyond diuresis. They are also useful in preventing recurrent calcium kidney stones by increasing calcium reabsorption. Thiazides are used as an adjunct in heart failure when mild diuresis is needed. Hydrochlorothiazide, indapamide and metolazone are common thiazide diuretics. They can cause hypokalemic metabolic alkalosis due to increased sodium delivery to the collecting duct. They reduce calcium excretion, which is beneficial in osteoporosis. Adverse effects include hyperglycemia, hyperlipidemia, hyperuricemia and sexual dysfunction. Hyperglycemia occurs due to reduced insulin release caused by potassium loss. Hyperuricemia results from competition with uric acid secretion in the proximal tubule. Thiazides may precipitate gout and worsen glucose intolerance in diabetics. They should be used with caution in patients with metabolic syndrome. Combining them with potassium-sparing diuretics helps prevent hypokalemia. Potassium-sparing diuretics act in the late distal tubule and collecting duct. They produce only mild diuresis but are valuable because they prevent potassium loss caused by other diuretics. They are divided into two groups: aldosterone antagonists such as spironolactone and eplerenone, and sodium channel blockers such as amiloride and triantarene. Their primary role is to maintain potassium balance and counteract secondary hyperaldosteronism seen in conditions like heart failure and liver cirrhosis. Amiloride and triantarene block epithelial sodium channels in collecting duct principal cells, reducing sodium entry and preventing potassium loss. They do not depend on aldosterone levels and can be used in patients who do not tolerate spironolactone. Spironolactone and eplerenone are particularly useful in heart failure because aldosterone promotes myocardial fibrosis and vascular damage. Spironolactone reduces mortality in severe heart failure. It is also used in hyperaldosteronism and resistant hypertension. However, spironolactone has hormonal side effects due to its antiandrogen action, causing gynecomastia and impotence in men and menstrual irregularities in women. Hyperkalemia is a serious adverse effect, especially when combined with ACE inhibitors or renal failure. Amiloride is useful in lithium-induced nephrogenic diabetes insipidus because it reduces lithium entry into collecting duct cells. These drugs may cause hyperkalemia, particularly when combined with ACE inhibitors. Triamterene may cause kidney stone formation and megaloblastic anemia. This slide demonstrates how vasopressin regulates water reabsorption in the collecting ducts. Antidiuretic hormone binds to V2 receptors and increases the insertion of aquaporin channels into the luminal membrane, allowing water reabsorption independent of sodium. ADH antagonists such as intravenous conivaptan and oral tolvaptan block these receptors and promote free water loss, a process known as aquaresis. These drugs are useful in treating euvolemic and hypervolemic hyponatremia such as in SIADH or congestive heart failure. However, rapid correction of sodium levels can cause osmotic demyelination and must be avoided. Dry mouth and thirst are common with many of these drugs. Tolvaptan may cause hypotension and elevated liver enzymes. This slide shows a comparison of renal solute excretory effects of various diuretics. The ceiling effect refers to the maximum diuretic response achievable by a drug. Loop diuretics have the highest ceiling, meaning increasing doses continue to produce increasing diuresis up to a high limit, which makes them ideal for severe edema. Thiazides have a moderate ceiling effect, making them useful for chronic therapy rather than emergencies. Potassium-sparing diuretics have a very low ceiling and cannot achieve substantial diuresis. The ceiling effect depends on the transporter capacity at the nephron segment where the drug acts. Once all available transporters are blocked, additional drug doses do not increase sodium excretion. This concept explains why switching to a loop diuretic is necessary when thiazides fail in resistant edema. Here is a summary diagram of the action of commonly used diuretics. Thanks for watching. Don't forget to like, subscribe, and share. Happy learning!